Hi, my name is Professor Jungcheol Park from JC Parkland. I travel a lot to give lectures internationally, and every time I talk about this specific suture technique called modified Laurell suture technique, people go crazy and they ask me about the details about this suture technique. So today, the topic will be the modified Laurell suture technique. I will show you the details and also the advantages and the healing results after this suture technique. So please keep watching this video and please also subscribe to my channel JC Parkland. Thank you very much. When you have a defect like this after implant placement, you're going to perform a guided bone regeneration GBR. You put the bone graft on top of the implant and the defects, and then you're going to place some releasing incisions and the collagen or resorbable membranes on top of the bone graft. As you can see, I have performed this modified Laurell suture techniques in the middle area, and medial and distal areas I have performed just simple interrupted sutures. It's the after 10 days of healing. After removal of the sutures, you can notice the almost complete closure along the incision line. The reason for this nice and excellent healing is because the flaps were all everted. The best way to achieve the everted flaps is to apply these horizontal internal matrix sutures. But as a clinician, you will not want to send this patient to home like this, because the incision line is open and you will fear that something gets inside and get the infection or inflammation. Therefore, we create additional interrupted sutures along the incision line. So after all, you apply 2 sutures of the horizontal internal matrix suture. On top of that, you apply interrupted simple sutures. So instead of doing 2 sutures, you can combine 2 sutures into 1 suture called modified Laurell suture. So before you close a tie after horizontal internal matrix suture, do not create a tie but to pass your needle through the loop created into the lingual or palatal aspect. Then, if you create a tie, it becomes the modified Laurell suture. I will show you in detail of the movements in the following video. This is the modified Laurell suture. This suture is very useful for GBR and implant surgery. The first part of the suture is exactly the same with the horizontal internal matrix suture. But before you create the knot, you pass the needle through the loop created on the lingual side. And then if you create a knot, you will have the horizontal internal matrix underneath, and over the incision line, you have a loop pressing down and securing the flap. So eventually, with this one suture, you have 2 effects from 2 individual sutures. This is the modified Laurell suture.